Every year in the UK, tens of thousands of people will experience a cardiac arrest outside of hospital, and statistics show that 1 in 5 people in their lifetime will have an opportunity to perform basic life support. This short instructional video will provide information on how to identify a cardiac arrest and what to do. This video is produced in collaboration with the Heart of Weston, who raise awareness and screen people to help tackle sudden adult death syndrome. Throughout this, we will follow the chain of survival by showing you how to identify a cardiac arrest and call for appropriate help, how to perform effective early CPR and early defibrillation using a public access defibrillator before handing over to the ambulance service for further care. Knowing what to do in an emergency is crucially important, as starting CPR immediately can double or quadruple the chance of survival from a cardiac arrest, yet only 40% of victims receive bystander CPR in the UK. Defibrillation within 3 to 5 minutes of collapse can produce survival rates as high as 50 or 70%, yet each minute of delay to defibrillation reduces the chances of survival by 10%, and less than 2% of victims in the UK receive defibrillation before an ambulance arrives. It is so important to realise that anyone can save a life with CPR and defibrillation. This video will show you how. Danger. The first step is to check the area is safe and there is no danger to yourself or to anyone else. Next, we need to check for a response. Shout to rouse the patient, then shake the patient. Get someone to call 999 if possible, either someone else or on your own phone with loudspeaker. Airway. We need to open the patient's airway by tilting their head back and pushing their forehead down as shown. Breathing. Check the patient is breathing by placing your head above their mouth and looking down the line of the body towards the patient's feet for 10 seconds. If they're not breathing, the patient is now confirmed to be in cardiac arrest. If you're unsure as to whether they're breathing or not, still follow the next steps. CPR. Now commence CPR by placing your hands on the bottom third of the patient's chest, locking your hands together as shown, putting your arms over the centre of the patient's chest. Push down, compressing at the rate of 100 to 120 beats a minute, trying to get to the depth of a third of the depth of the patient's chest. Defibrillation. During the 999 call, the operator will advise you where the nearest public defibrillator is. Ask another person to get the defibrillator as quick as possible and to take the phone with them. When they arrive at the defibrillator, the operator will give them a code to access it. They should then open the box and remove the defibrillator. Once the defibrillator arrives, open the box. Place the defibrillator pads onto the patient's chest as shown. Follow the instructions. While the appearance of the defibrillator may vary, it should always give clear instructions.
Stay clear of patient. Analyzing heart rhythm.
It may ask you to stand back and may shock the patient.
Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered.
Or it may ask you to continue with compressions and not shock. Carry on with this process until the emergency services arrive and tell you what to do. You may be asked to carry on compressions for a short time. In conclusion, when presented with a collapsed person, follow the steps as shown in this video. Danger, response, airway, breathing, CPR, defibrillation. Early identification of a cardiac arrest and timely CPR and defibrillation is proven to be the best treatment for a cardiac arrest and improves survival chances. For more information or further training, please contact the Heart of Weston on the details below. Thank you for watching.